that I just wanted to use to talk through as a very brief intro in terms of thinking about how we can go about reusing and recycling equipment. And I'm pleased to say that there are lots of things that we can do. And I think we've got some great speakers as well lined up. And just to kind of talk about sort of where, in terms of when we're talking about equipment, what other things are happening at a broader scale to try and move our supply chain into a net zero direction. You may have seen this before. If you haven't, this is kind of like the headline suite of policies that we have that is working with the supply chain and setting out the expectations of them over the next few years, as well as some of the milestones that have already come in play that are trying to get them to move at a contract level and also at a entity level. But of course, it's really important that we identify what we can do in the system to try and change demand. And that's something that really helps to push the suppliers to think about what more they can do. So we produced a number of how-to guides. This is an example of just one slide in one of them. In all of them, we try to provide the business case of the sorts of things that you should be trying to understand to help look at why you should take these sorts of things forward, giving you the carbon, the cost savings, any considerations that you need to think about in terms of risk, how that sits into overall greener NHS policy, and trust case studies that give you that example of where this practice has already been taken place. We've produced quite a few of those across different areas, and for walking aids, we have been monitoring performance, and I'm really pleased to say that we are now at the point where 74% of trusts are reporting that they have some sort of scheme in place. So that's great. We've got a range of corporately branded materials that you can access for free to make it easy for you to have something that's nice and clear to show patients, to help promote the message and to help give a consistent look and feel across the system, because patients don't really think about the NHS necessarily in discrete trusts or things like that. They think of it as a whole. So it's great to have that view across what's happening across the system. So it doesn't matter whether you move or where you need to go for your treatment, you start to get a feel for that this is something that's happening nationally. And we've also used there a website that helps make it easy for people to understand where to go and how they can identify those drop-off locations that you can give us details of if you set any further ones up. So some of the other guides that we've got that are available in terms of other sorts of initiatives that have had a supply chain focus, you can see there from walking aids to our most recent one we've released just last week around the reusable surgical and isolation gowns, to looking at remanufactured medical devices, reusable sharps containers, rationalising the number of instruments on pre-prepared trays for surgery, and also catering and the like. And they all follow a similar format. So we can share these slides afterwards, and then you'll have the links there that you can grab those guides and also access case studies that we've got out there to support this. So yeah, I just really wanted to give a bit of a kind of a flavour of, there's lots of things out there that you can do when you're looking at trying to take forward these approaches. I know some of the case studies that we've got that are going to be presented to us are looking at donation, and that's a great first step to getting started, because it will still make a difference in terms of your waste and carbon in terms of your waste, but ultimately where we're trying to get to is, wherever possible, looking at how do we reuse within the NHS, because that gives us the maximum carbon benefits. But looking at donations is a great step to getting started, because quite often that requires you still to have a number of the conversations, get the buy-in, and start to put the processes in place that you can then, hopefully from there move on to looking at, getting scale up and starting to reuse within your organisation. And so I'm just going to stop there, and I think we're ready to probably hand over to the first speaker.
Lucy, would you like to take over now?
Thank you. Thanks, Nicole. So let me just get my presentation in a second.
Thank you, Nicole. It's good to have the background there. That's really helpful.
Okay, can everybody see that?
Yeah.
Great, thank you. It's always disconcerting when you can't see the people, but just see the slides. So my name's Lucy Swift. I'm one of the occupational therapists from the Royal National Orthopaedic Hospital in Stanmore, and I work in the chronic pain service. This project came about because a colleague and I, a couple of years ago, sort of sat down and said we need to be doing more sustainability work as a therapies department. And what can we start with? And we thought, well, we could start with the equipment that we issue to patients post-surgery. We thought that would be some low-hanging fruit that we could start with and maybe make a change quite quickly. It turns out not to be the case. It turns out it's far more complicated than we initially thought. But I'm still chipping away at this. My colleague's retired, so I'm still chipping away at this 3 years later. So let me just up to the next slide. I think we've said, Jackie, did you want to say anything about housekeeping, or have we done that?
I think we've done all of the housekeeping. Thank you very much.
I'll keep going. So this is just to say I'm talking specifically about toileting and bathing equipment that we issue to patients after their elective surgery. I'm not including walking aids because we've actually done a really good job with that. As Nicole mentioned, we've made a lot of progress in recycling those. So people come to this hospital and have hip replacements, revision hip replacements, shoulder surgery, knee surgery, and basically various different joint replacements. We see lots of patients with cancer as well who have surgery, and often they may require equipment after the surgery. But all of the surgery is planned. So what is the problem? What's the issue? Well, the issue is that we're sending patients home with brand new bathing or toileting equipment after their surgery. This equipment is not then recycled usually and may often end up in landfill. Hospital transport are not always able to take the equipment with them. So in some cases, it may be sent by taxi at large additional costs. And we've recently had some new theatres built as well at the hospital, which means more surgical activity and then more equipment will be needed. So obviously we have quite a quick turnover of patients. Patients leave hospital after surgery much more quickly than they did years ago, and there's a pressure on beds as there is everywhere. So in terms of costs, the therapies department spent over £28,000 on bathing and toileting equipment in 2023. So just to give you an idea, a commode, for example, not that everybody needs a commode, but some people do. Commode costs £45 each, a raised toilet seat £14, a perching stool may be required, that costs £27, and then a toilet frame, for example, is £30. And then there's the cost of transporting equipment as well, not to mention the environmental cost. So what do we need to do in this scenario? Well, obviously we need to be better with our clinical reasoning. We need to be questioning whether people really do need the equipment, and if they do, how should we provide it? We need a cultural shift away from disposability, which I think got worse during COVID. We also need to educate staff to be able to save money and the environment. So therefore, we need to consider both what we are providing to patients and the way that we provide it as well. And patients are coming to us sometimes and saying, what do I do with this piece of equipment when I'm finished with it? And we're not able to take it back at the moment, but we are sometimes directing them to charities. But it is also easy to see that when a team is chronically understaffed, then they will go for the quickest option to get somebody out of hospital. If there's a new piece of equipment there that they can give someone to speed up their discharge home, then they will do that. Oops. Sorry. So the possible solutions that we thought of were, first of all, can we order equipment to be delivered and set up in patients' homes before surgery, and then their local community equipment service could then collect it, clean it and recycle it. Could we keep our own stock of equipment that we would then issue, and patients would bring it back when they'd finished with it? That's what we used to do many years ago. We had our own stock. Patients would bring it back, therapy technicians would then clean it in the therapy bathroom, and then stock it and reissue it to patients. Or the alternative was we hold stock from a company and then issue it to patients, and their local equipment service would collect, clean and recycle it. Just to reiterate, we are a national hospital, so we can't access every local authority's system across the whole country. And if we had, if a member of staff has a PIN for a particular ordering system, if they don't use it for a few months, they then get locked out of it because the local authority assumes they don't need it anymore. So we do have, there's the challenge of dealing with many different areas.
Lucy, you seem to be muted. Sorry.
Oh, sorry, I don't know what happened there. Sorry about that. So first of all, staff availability to clean, check and recycle equipment. Teams are not set up in the way that they used to be to allow staff to do that. It takes time to train people to use online ordering systems, and there's paperwork to go through to get PIN numbers. Reluctance of patients to accept recycled equipment, especially when it's for use in the bathroom. People often like to have new things. Transport not taking large pieces of equipment because they can't secure it in their vehicles, or they literally don't have the space for anything more than a patient and a walking aid. Storing things here and effectively decontaminating them was also an issue. There's a possibility of delayed discharges, obviously, if equipment packages are not in place. If a patient's not available to accept equipment before their admission, then that can be challenging as well. And potentially, if we loan people our own stock, they may not always return it. Sorry, there seems to be a delay in changing the slide. I'm not quite sure why. There we go. So we felt the ideal scenario would be that every county or local authority would fund the equipment for their patients. We would order it through one national portal. That would be the dream, but that's unlikely to happen because every area has a slightly different system, different paperwork required. However, what we have done so far, and this has been over a fairly long period of time, we thought we'll start with London. So we liaised with the London Community Equipment Consortium about training staff and getting PIN numbers. Our lead OT in the orthopaedic team, so this is not my team, but she is in the process of getting her staff set up on different systems. We got permission to start ordering equipment from Community Equipment Services because that was a challenge. We're starting with the pre-admission staff to get them trained up. NRS have the contract from most of the London boroughs, so that means one ordering system, which is good. But it's very slow. It's a very, very slow process. We have I've been talking to staff, raising awareness of the Trust Green Plan within teams, presenting to the OTs particularly, trying to get people to understand what the issues are. I've also spoken to the head of procurement at the Trust, and she is chasing suppliers for their sustainability policies, which kind of feels like the wrong way around. I feel we should be prioritising suppliers who already have a sustainability policy and are being held accountable for that. So there's lots of different angles that we've been taking on this. The next steps are to get all relevant staff trained at least with the Harrow Community Equipment Service and then spread out to other London boroughs. That would be a minimum of 7 staff in the acute orthopaedic team. We hope then to spread out to other London boroughs. I've been in contact with Brent and Barnet recently, continuing to raise awareness among staff and sort of gradually work on this cultural shift. And I've been meeting with our sustainability lead and hope to meet with NCL Integrated Care System. That's North Central London Integrated Care System. And I have also thought about a letter to the commissioners as well. We have been scuppered a little bit by a recent cyber attack on NRS, so they're not giving out any PIN numbers for the time being until that is sorted out. But hopefully that's just a temporary measure. And then just some ways to get involved. I don't know if people have seen this slide at the end of other talks, but there are various ways if you are interested to get in getting involved. Jackie, I don't know if you've been through, have you been going through this slide at the end? Or
I think I'll wait till after Sue and Elka have done their bit as well. So
Okay.
yeah, so
Right.
have you finished your
Okay.
part now then? Yes, lovely. Okay.
Yes, thank you. I'll stop
Thank you.
sharing.
I expect people will come back with more questions at the end, but thank you very much. So Sue, if you would like to do your bits well now.
Yes, thank you very much. Thank you, Lucy. Thank you, Nicole. Thank you, Jackie. Can everybody see that?
The moment we can see you.
Okay. What did we say about technology? Okay. I did go to another go. Can you see it all?
No. Have you? Are you clicking on the share?
Yes, I am.
And what comes up for you then?
I get the slides, but presumably no one else.
I think you need to click it on window or screen, and then.
No, it's not. I'll have to ask you, Jackie, I think.
Okay.
To share because it's not doing it. I've tried everything I know. Sorry. So just in the meantime, just to introduce myself, I'm professionally, in my professional life, I'm an expert witness. I'm an occupational therapist by background, and I'm an expert witness, and I also am a senior manager for Keystone Case Management, which is case management and expert witness services company. We're based in London, although I live in the southeast. All of what I'm going to be talking about and Elka's going to talk about is something that I do in my own time. Elka, do you want to briefly introduce yourself?
Yeah, so I'm Elka Small. I'm retired now, occupational therapist, and I was occupational therapy service manager for Bristol City Council for a number of years. Yeah, so obviously in dealing with a lot of equipment and different kind of scenarios in people's homes, and being very much aware and corner of my eye thinking, what is this pile of equipment doing outside the equipment store? And it sort of went from there, really.
Yeah. So I'll keep going if that's okay, because I know we're short on time. We want plenty of time for questions. I thought we'd start with giving you a little bit of a background. We come from a very different perspective from Lucy, really, and what the work that Lucy's doing. Yes, hopefully it'll be interesting. We'll give you a little bit of background to Romania, first of all, then to one aspect of the work that we're doing in Romania and how that ties in with the equipment side of things and what we're trying to do in terms of recycling. Romania, for those you don't know, is a very large and beautiful country, famous for its Transylvanian region and its Count Dracula, and really vast, untouched mountainous areas and countryside. And in 1989, rather, it had a political revolution where the people rose to overthrow the dictator at the time, who was communist, and it opened the world up to scenes of extreme poverty, and particularly in regards to people with disabilities, of children in particular, and orphanages. And the Western world rushed in with humanitarian aid and all sorts of things, and have gradually just all disappeared. Do we have any slides at all?
I'm really sorry. I can't.
No.
I'm having trouble finding
Okay,
them.
that's fine. I can have another crack if you like. I don't know why I'm having trouble. Let's have a go. Because I just think it would be helpful. Have another go. Can anybody see anything now?
Do you want me to have a go? If you can carry
Yeah,
on,
if
Simon,
you
I'll
like.
see if I can, because I think you emailed, I think I was on the email that you sent.
I don't know
so.
why it's not. So apologies.
I think there's some pictures we don't have because we're not on Teams, Sue. We don't have Teams.
Okay. Well, that's my fault. So one of the things that we've certainly learned, well, from our experience, that although things have improved in Romania in the last 35-ish years, actually there are still observable difficulties, such as a very poor infrastructure and also a lack of health and social care. They might debate that. And particularly continued marginalisation of people groups such as the Roma, who live on the edge of society. In terms of their attitudes to disability, thank you. So if you, great, whiz on down, that's the just an example of the Roma, really. In terms of disability, we would say that often their attitudes is that it's tokenistic. Children with disabilities don't usually go to school, for example, and due to a lack of access to basic equipment such as walking aids, many people who've had an injury or an illness or a disability can go back to the ramp picture, please. Are housebound, they're isolated, they're reliant on family members to assist them in all areas of activities of daily living. And they're often stranded in apartment blocks, which are left over from the communist regime. So we've been working in Romania since about 2006 voluntarily through a charity called Belief in Action. And we're just going to talk about one aspect of one of the projects, because we do have two projects in Romania. And this is about focusing on recycling disability equipment that we found was destined for UK landfill. So working collaboratively with Romanian registered charities, we organised the collection and transportation of items to go to an equipment loan scheme, which we helped establish some time ago now. It's grown considerably in more recent years. So next slide, please. How do we do this? We realised, like other people who are talking this week, and like Lucy as well, that there are untold amounts of equipment, medical and disability equipment, just being thrown away in this country. And very often it can be used again. It might have minor problems, or there are procedural or purchasing or supply chain problems, which mean that it doesn't get used again. So to cut a long story short, we partner with a range of different organisations and groups, some of whom are shown on this slide here. We accept goods such as hospital beds, walking aids, commodes, wheelchairs, specialist seating, but we also deal in humanitarian aid, things like baby boxes for Roma teenage mums and so on and so forth. Next slide, please. At Christmas, we send shoe boxes, and we also liaise with PhysioNet, who are a charity doing very similar work to us. One of our major partners are Mediquit. When we look at Mediquit, their national coverage is shown here, but they've grown since. They've also acquired a contract in the Bedford and Milton Keynes area, and they have also just won a contract in Cornwall, which will come on stream in the 1st of October. That's a huge number of depots with a huge number of skips full of stuff that they are often sending to waste. But we've been working with them over a long time and trying to develop a smooth process for continual recycling. And they are much more on board than they were. long way to go still, but they do have specials coordinators at their depots who have responsibility for liaising with us, and also have appointed now a general manager who has been assigned a decarbonisation lead role. They are aiming for carbon neutral by 2030. We put it on, next slide please, Lucy. We have joined forces with a Herefordshire charity as well. We're very much into collaborating wherever possible. They were doing a similar job to us, but their distribution places overseas, it was no longer possible politically for them to go there. So they help us load these lorries. We send these lorries every 3 months-ish over to Romania. And Mediquit now will directly deliver to this particular trust for them to store and catalogue and then help us. We use a logistics company in Kent to help shift this stuff over into Romania. It's now quite complicated with customs, so they post-Brexit, so they help with that as well. But we believe that using an equipment, next slide please, Lucy, that using an equipment loan model is quite unique because that allows for continual recycling until an item reaches the end of its life, and then the metal, if there is any metal, is reused for other purposes actually. We found that this enables the local team, who we have trained in assessment and in provision and repair, to maintain contact with beneficiaries, people coming to the loan scheme as well, and their caregivers, and then offer them additional services, including caregiver support, food and clothing, social activity groups, and then any training that they might need. We also follow up with regular visits, taking healthcare professionals and other volunteers, anyone who's willing, frankly, to provide ongoing support and training, but also to review beneficiaries, particularly if it's specialist seating. And this slide is showing some of the British volunteers just sorting out wheelchairs and cushions provided by the Wiltshire Wheelchair Service, who have, by the way, reduced their spend on waste by about £100 a week by just checking them over, checking any decommissioned chairs over and sending them our way. So Elka's going to give you a couple of case studies as well in terms of the benefits of it for individuals. Next slide, please, Lucy.
Okay, so what we noticed, obviously because a lot of this equipment was actually originally coming from social care, and we were able to send over some very specialized pieces of equipment for the children. And as you see in this particular slide, this young lad has got cerebral palsy and other issues, but so he doesn't sit by himself, so he's carried everywhere. And in the daytime he lies on a day bed, and if he's not there, then he's carried by his mum, or he was up until that point. But when we were able to send specialist seating, he was able to sit up and start to look around and take an interest, and there was eye contact, there was hand coordination, there was finger feeding, all this sort of thing. And it's absolutely made a huge difference to be able to provide this facility for the children over there, because that's really, they have absolutely nothing. Everything over there has to be paid for. Obviously they don't have a health service, and sometimes the advice that they get isn't particularly good or accurate, so they can end up buying equipment that perhaps isn't as appropriately provided as it can be. And on the back of that, we send over teams of therapists twice a year to do assessments and provide advice to the carers, and we do reviews as well, as Sue said. Yeah, next slide, please. All right, so this is a Ukrainian lady who, because the people that we work with over in Romania were also in a position to receive disabled Ukrainians that were fleeing from the war. and were housed in the local area. And obviously, because the equipment store was nearby, we were able to provide appropriate equipment. And this lady in particular is having her chair adapted there to the right height, so she can get up out of her chair independently to toilet and wherever she wants to go. Next slide, please. Yeah, so this is an example, another example of how people sort of, this is a Downs boy being carried by his dad, and that's the only option they had until they came to the store, and we were able to provide him with a buggy. And in a sense, it's very, very simple, but it's also really important, you know, to be able to give carers a bit of a break. Okay, next slide, please. So I think really lots of questions for us, and what occurs to me in now, and a presentation I saw earlier, is whether or not actually health and social care are joined up in all of this work. So that was just a thought that I'll plant there. But you know, in a sense, why is so much not being recycled and refurbished here in the UK, and why are we being offered vast amounts of equipment, hospital beds, which are being disposed of by asset management companies in London? So we're interested in having a top-down and bottom-up approach to see more recycling done locally, nationally, on the agendas of hospital commissioners and investors. So what we're trying to do with very limited resources is really the tip of the iceberg. Yes, it helps those in need in other countries, and this is how this whole thing started. There was a need, and we tried to meet that need. It was for a particular family. This is how it all started. And then we realized there was so much more that could go across to Romania. And this is then ramped up, and we're now sending one 40-foot lorry a quarter across to Romania with equipment. But why is so much of our public money going to waste? We even know of a charity which is selling social care equipment, as they do in charity shops and car boot sales. And so also, why is there no consistent agreed process within the NHS commissioners as to what is not acceptable to issue and what is? And why, for example, is a technician in each contract not seen as viable to refurbish equipment?
Those are all very good questions, very good questions. Do you have a lot more to say, Elke? No.
I mean, no, other than just a plug for people who would like to come out and see what's going on in Romania and be part of this process of recycling in the way that we're doing it at the moment. So anybody interested, just get in touch.
Thank you.
Thank you.
Thank you all for your presentation. So there's a lot of questions there, and maybe I'm going to stop recording now so that people can put their cameras on and we can have a discussion.